Hello everyone, welcome to HW News. The COVID-19 situation in the country seems to be spiraling out of control. In some states, the situation is so bad that there are no beds available for patients. Critical patients are denied treatment because the health infrastructure is already stressed. In some hospitals, there are no oxygen cylinders, whereas in others, ventilators, ICU beds are falling short. People are taking it to Twitter to seek help, to seek bed or any kind of help that will save their friends, family members affected with COVID-19. If you still haven't wrapped your head around how serious the situation is, let me show you some visuals. These videos could be sensitive for some, so I would request people to proceed with caution. Now this is a video from Lucknow that you are seeing right now on your screen, a series of pyre burning the dead. The video is from ghats of Ganga river near Bhainsakund, and locals say these visuals are unprecedented. There is a constant influx of dead bodies, with COVID-19 claiming more lives in the country. Crematoriums are working non-stop. But this is not just in Lucknow. Now take a look at another video, and this one is from Ahmedabad. A queue of ambulance waiting outside the hospital so that patient inside the ambulance can finally get a bed. This is a visual from Gujarat's Ahmedabad. There is another video here. There is such a long queue in Surat Crematorium that people are cremating their loved ones in open grounds. This is dangerous, also hazardous for other people who are not infected with COVID-19. But this is happening in Surat. Now let's look at another video, and this video is from Madhya Pradesh. Pyres are seen lined up. It is an alarming situation that crematoriums are inundated with dead bodies, although almost surprisingly, in some states the numbers don't match with the official death count presented by the government. We will talk about this in today's video. India today reported record 2 lakh cases. Since last 3 days, the country has been reporting more than 1,50,000 cases of coronavirus. As far as death toll is concerned, for the last 2 days, it has also crossed the 1,000 mark of the death toll. Now, let's look further. As far as death toll is concerned, for the last 2 days, it has crossed the 1,000 mark. Daily, more than 1,000 people in India are dying due to COVID-19. And that is just what official data tells us. Some also argue that the death count is such low as a percentage of total new cases, the death toll is insignificant. But those who make this argument conveniently forget that those died were functioning, breathing human beings before COVID-19 got to them. Every death counts, every life matters. But many local media are also reporting that while the crematoriums are filled with dead bodies, the states in their official data are reporting low numbers of deaths. And this discrepancy has led to the question of whether the state governments are trying to hide the death count to downplay the COVID severity in their states. Let's talk about some cases here. First is from Gujarat's Ahmedabad. If you are to believe the local media, then Gujarat is facing a major health crisis. So much so that the High Court of Gujarat had to get involved and declare that the state is facing a health emergency of sorts. Moreover, the local media is stressing on the discrepancy between the official death count and the deaths reported by the crematoriums. For example, the state government had officially declared just 20 COVID-19 deaths on April 12. But Sandesh, a leading Gujarati newspaper, claimed that at least 63 people had died in just one government-run COVID-19 hospital in the city on the same day. In a report published in Sandesh on Tuesday, the paper claimed that its journalist had arrived at the figure by camping outside Ahmedabad Civil Hospital's 1,200-bed dedicated COVID-19 wing for 17 hours, counting every dead body which was being brought out of the morgue from midnight to 5 p.m. on April 12th. Now, another striking example is from Jamnagar, where the government-run Guru Gobind Singh Hospital has been choked up with COVID-19 patients, not just from Jamnagar district, but also from the neighboring district of Morbi, Rajkot, Junagadh and Amreli. While the state government claims that there were 0 COVID-19 deaths in Jamnagar on Tuesday and barely 1 death on Sunday before that, A local digital news publication, Khabar Gujarat, claimed that around 100 people in Jamnagar died of virus within 48 hours between April 10 and April 11th. On April 13th, however, the news site reported 54 deaths in the city. But this was a discrepancy that was found with the official data that was put out by the state government. Now let's talk about Madhya Pradesh. Madhya Pradesh recorded almost 9,000 cases and 40 deaths on Wednesday morning. The state has over 43,000 active cases. However, the claim of recording the correct number of deaths by the state is disputed by people on the ground. According to them, there is a severe inconsistency in the deaths reported by the state. A crematorium in Bhopal recorded 37 deaths on Monday, while the state health bulletin reported 37 deaths in the entire state. This is not the first time that such a discrepancy is being found in Madhya Pradesh's death toll. As per a News 18 report, the death figures for the last 5 days in MP were also found inconsistent. On April 8th, a total of 41 COVID bodies were cremated in Bhopal under the COVID-19 protocols. The medical bulletin of the day reported just 27 deaths in the entire state. On April 9th, 35 bodies were cremated in Bhopal alone, but the state government data for the entire state for that day showed that 23 COVID-related deaths occurred on that particular day. Now, the report said that on April 10th, 56 bodies were cremated in Bhopal, but the government data claimed only 24 people died due to coronavirus in the entire state. Similarly, on the next day, that is on April 11th, 68 bodies were cremated in the city, and the government again reported a total of 24 deaths in the state. This again is a discrepancy found between the bodies that were cremated and the government data that was put out. Now let's talk about Uttar Pradesh, the video of which went viral on social media. On Wednesday, the most populous state recorded close to 20,500 cases and 67 deaths. A video has been doing the rounds that show rows of funeral pyres burning in already overburdened crematoriums in Lucknow. These crematoriums are cremating bodies 3 to 4 times their original capacity. The cumulative official COVID death count released by the government in the last 7 days is 124. However, as per the records maintained by the city's crematoriums, over 400 people who died because of the virus had been cremated during the same period. The Lucknow Municipal Corporation on Wednesday increased the number of pyre platforms after several complaints of long waiting queues for cremation of the deceased came up. Now, shockingly enough, according to several Twitter users and local journalists, the authorities in Lucknow today set up a tin sheet to cover up the Bhainsakund crematorium ground in Lucknow, allegedly to avoid people from clicking the pictures and recording videos of the pyres being burnt after the video went viral on Wednesday. Now, why is it important that the data should be accurate? I will talk about this case that we are talking about today. As I said at the start of the video, what is the parameter using which the state can claim that it is faring better in the fight against COVID-19? The answer is data. If the deaths are underreported, then that directly affects the assessment of severity of COVID-19 in that particular state. So we have people saying that, see, COVID cases are more, infections are more, but deaths are less, and then the threat of coronavirus is downplayed, which is dangerous, especially when we are fighting a ferocious second wave of the pandemic. Thus, it is very important that states give us an accurate death count of coronavirus, which will help us in assessing what exactly is the severity of COVID-19 in that particular state. Do let us know what you think about this in the comment box below. For more news and updates, you can log on to www.hwnews.in. Also, a request to all of our viewers, please wear your mask, maintain social distancing, and wash your hands regularly, and be safe from the pandemic. Thank you so much.